Join.
Okay. Oh man. So am I live? I'm live now. Yeah. Let me see that. Yeah. What's up, Facebook fam? This is Art Woodson. Thought I'd come live for a second. Uh Definitely need to speak about hold on everybody. Need to speak about COVID, man. Really need to speak about the COVID. Um there's so much stuff going on. There's so much stuff going on, man. And honestly, so many people and talk with so many different people about COVID, man, that has it. This not talking about Dr. Fauci said this. This isn't CNN telling me stats. I'm talking about these are people, individuals, humans, telling me, how they feel, that they have it. Uh, and me and Dr. Furholder, I'm gonna say it one way, and she gonna put the stats out a different way. I'm not here to debate. I'm not here. Well, my science or the people I know said this. I'm not here for that. I have my side of it. You have yours. And what I'm speaking on is what I see or what I have been seeing every single day. And it breaks my heart. It breaks my heart to know that my little cousin is suffering. My best friend, I call him my best friend, Tony Palladino is suffering. So many others are suffering from this COVID right now. The main people who are suffering is the nurse, the doctor, the hospitals, the patients who can't see a doctor through emergency because of so many COVID patients. Those are the people who suffer. And we're sitting back debating about who should wear a mask, who shouldn't wear a mask. Well, this doctor said this about a mask, or this doctor or this politician said, that this is going on. This politician said that. I'm not here for that. I'm not here to debate all that. I'm not here for that. I'm here to speak the facts on what I know, personal facts of what I have seen and what I have talked, where I've talked to people. And Dr. Furholden is going to back it up with data. And Dr. Furholden, how you doing?
I thought I was going to have a Christmas break, but when your phone rings and it's Art Woodson saying, Doc, what's going on? This is my experience. This is what I know is happening. Tell me the science. Tell me the numbers. Tell me the data. I gotta jump in. So I'm
and,
here.
and, and let people know who you are, who might not know, or we want to familiarize them or introduce them to who you are in the community and what you're doing, and just start off with some of the facts or some of the data. Let's just start off with some of the data that because this is our truth. This is what we know, and it's not, and you're a number cruncher. You're a number cruncher, and you let science lead you. You let data lead you. So let's start off with yours first, and I can come in with some of my personal things, and you can come back with some of those same data driven answers to what I see.
Yeah, so I live in Flint. Um, if you look on my Facebook, you'll see I have an interest in hodgepodge. I got the DMV, that's the DC, Maryland, Virginia area, because I'm originally born in DC, moved to Flint when I was 14 with my mom. She worked at the Creative Foam in Fenton. Stepdad worked for Truck and Bus on Van Slyke. So I got like the Flint roots. I went to Flint Northern, came back here during the water crisis because what an awful public health crisis that was. Little did I know we'd be facing a pandemic. And as an epidemiologist, which is what I am, I'm trained in studying disease outbreak and the outbreak of epidemics. That's when you get disease in excess proportions in your populations. And we are in what's called a global epidemic or a pandemic, which is COVID-19. So I help to crunch the numbers every week so that we can understand what's happening in Flint and Genesee County. We have been on a steady increase. Even when the national rates were going down, we were still going up in Genesee County, in Flint, and in the state of Michigan. They called it a surge. We were in a surge. And then the nation soon after caught up to us. And I've made no secret about it. I contracted COVID myself. I attended a event, a wedding in Wisconsin, and I contracted COVID. Found out that, in fact, I had contracted the Omicron variant. This was in November, late November. Thank God I honored enough protocols when I came back. I did not infect anybody else except my daughter, who lives in my household. But I understand both the data and I understand the personal side of it. And Art, you and I have battled a lot because I've been trying to get people like you to get vaccinated from the beginning of this pandemic. Not because I thought the vaccine was the answer, the one and only thing, but I know that it's an important piece of the puzzle in helping to get us on the other side of this pandemic. So I'm happy to talk to you about the data, the numbers, and also share my own personal experience having both been infected with COVID. My son is an active COVID case right now. My daughter just had what she described as a traumatizing nightmare experience of spending the night in the emergency department in a Flint hospital. I want to just use this opportunity to impress on people how important it is that people prevent themselves from being infected in the first place, and two, prevent themselves from having to go to the hospital or the emergency department, where unfortunately the system is overwhelmed and they're not going to get the kind of care that they would normally get and that they would need that would be life-saving.
So, Dr. Verhoeven, the other day, you and I, because I've been calling you a lot in the past week, you know, we talk about the cancer cluster study, but that has taken a backseat again because of the Omicron. Yeah. And I called you on that. I can't remember what made me call you, but it was something dealing with the mask. And you told me something about Omicron in the mask. Can you tell the Facebook fam what you told me about the mask and Omicron?
So I've been telling people the notion that we got to worry about which variant it is and all of that, the very same precautions that protect people will protect them, it looks like, depending on what variant we have. But the reason it's important to understand and keep studying these variants is because they all behave a little bit differently. Omicron, it turns out, is, think of it like this. Imagine you got a piece of gum that you've been chewing on for 2 days. That gum might not be as sticky and as gooey as a piece of gum that you've been chewing on for an hour. Omicron is very sticky. It takes very few particles for you to breathe in or for you to get in your nose or your mouth or in your system for it to attach to your receptors and start replicating. Omicron is very, very sticky. It will replicate a lot faster, and we are seeing more breakthrough cases of Omicron because of that. As a result, and I've done demonstrations for people on masks, and I do. I have my I have my KN95 mask here.
I got mine right here.
Right? These masks have like 4 or 5 layers within them. Okay. Yeah, right. Look, Art, same as me, right?
Right,
Didn't
right,
even plan that, but we got the same one. You got black, I got gray, right?
right.
But Omicron, it takes so little of the virus because you've been exposed to other, everybody has been around somebody that had COVID and didn't get COVID, right? Like you've got some, oh man, I was with so-and-so and they tested positive, but I didn't. Omicron is not like that. Omicron, it takes very little viral exposure for it to stick in your nose, in your throat, bind to those receptors and replicate. It's more sticky. So exposure that you might have had in the past where you wouldn't have got an infection, you get exposed to Omicron, you will likely get infection. So what you need now is you do need your mask, but you need a mask that provides better protection. So the N95s, the KN95s are going to be the best mask to protect you and prevent you from contracting Omicron.
To me, I was watching CNN, and CNN told me that a cloth mask is definitely not effective as far as wearing a cloth mask. And to my Facebook fam, I always said that I'm not advocating for the vaccination shot. I still don't. I'm not advocating, but I'm advocating now. I'm advocating now because here's the problem, right? Like I said just a little while ago, the hospitals are full. And if you go to the hospital right now, Hurley, McLaren, Genesis, they're not even accepting anyone. And if the vaccination shot, I'm not saying that it's a cure-all. I'm not saying that it'll prevent you from getting COVID. But what I am saying is it can prevent you from going to the ER. Some people, some, not all. I'm not going to say that it'll prevent everybody who gets the vaccine shot. It'll stop you from going. I'm not saying that. But what's the percentage of people in the hospital, Dr. Farrell, do you know?
Right now, the percentage of people in the hospital that are vaccinated, that are known and fully vaccinated, is about 25%.
How many?
About 25%. About 25%. And if you give me a sec, you keep talking, I'll pull up a little graphic and I'll share it. That'll show you week by week the percentage of people in the hospital who are vaccinated and unvaccinated. It varies somewhere between about 20 and 30% of the people who are in the hospital that are vaccinated, which that means on any given week, about 70 to 80% of the people who are hospitalized because of COVID are unvaccinated. That's an important number to know because I understand people are asking themselves, well, if the vaccine is not going to prevent me from getting COVID, why should I get the vaccine? And I tell people it's 2 reasons why. Number one, because you want to reduce severe symptoms. People who are vaccinated have less symptoms than people who are unvaccinated. People who are vaccinated are less likely to end up in the hospital and are substantially less likely to die. It's not 100%. If you're older, immunocompromised, you have a lot of other health conditions, all of those things will factor in, but the vaccine gives your body and your immune system the best opportunity to fend off the virus. So it's not about necessarily preventing you from ever getting it. And that would be ideal. In an ideal world, vaccines will stop you from getting the illness in the first place. But that's not what we're dealing with. What we're trying to do is prevent people from getting really sick, ending up in the hospital, or dying from the disease. And the vaccines do support that. And you might know somebody who got vaccinated and maybe even got boosted that still ended up getting sick or needing to go to the hospital and ending up on a ventilator. But just know that you're 3 to 4 times more likely to end up in the hospital or on a ventilator if you are unvaccinated.
So I took I got my 2 shots, Pfizer. I had COVID and I had the antibody infusion.
Yeah.
I have been around, I think, I say about 5 people who had COVID. And all I can do is speak about me, about me. Everybody, I'm just speaking about me. I'm not saying that it will do this for everybody. I have not gotten sick. I haven't tested positive for COVID. So it helped. I'm not saying that it prevented me from getting it. I don't know. But I know that I took the shot, the 2 shots. I know that for a fact.
Yeah.
I talked to my cousin. My cousin has COVID. And the way that he sounds and what's going on with him, it breaks my heart. And he works at a dialysis, whatever I forgot what they call it, but he does dialysis.
Yeah.
They need him there. The people who need to do dialysis, they need him. We need the nurses. We need the doctors. We need all of them. If wearing a mask and taking the vaccination shot will curb all that, we need to do that. We really do, everybody. This is a war going on. And in the military, I was a nuclear biological chemical specialist. Chemicals, we was able to, detect. Nuclear, I was able to measure how big the mushroom cloud is and tell you if it's upwind or downwind. Biological was the hardest one to study and trace because it can be in a mosquito, it can be in a human body, this is what it is, a biological war against a virus. And everybody has to do their part against this enemy, which is coronavirus. I understand being rebellious. I understand your right, pro-choice. I don't think anybody's bigger than me in pro-choice. I don't think anybody is. But if we can curb people going to the hospital to where we can give, do you think, Dr. Verholden, do you think that our hospitals are on the brink of collapsing?
I will tell you, I've talked to and then we're going to look at some of these questions. There's some great questions over here. So if you will answer them, I just wanted to point your attention to them in the comments. And Amy, thanks for asking that. We will come back to that. What I've been told, a very good colleague and a friend was a former head of an emergency department at a major hospital system, I'll just say in our community. And her exact words to me were, this is what a healthcare system looks like right before it collapses. I'm going to take for a second, my Dr. Verholden hat off and put on my mama hat, because I'm a mother too. Before I was any of that, I was the person that I am. My kids don't look at me as Dr. Deborah Verholden. They look at me as mom. They don't care about what I've got going on, what I do out in the world. When they're sick, who you want? You want your mom. When you need to go to the emergency department, who you want? You want your mom. My daughter, who I gave COVID to, Omicron, this so-called light version of the virus. Everybody say, oh, it's just like a cold. And I feel like in the back of people's minds, they're saying, oh, I should just go ahead and get it, because then I'll be, have that natural immunity and I can just be okay. Well, my daughter, who gave birth to my first and only grandchild 3.5 months ago, 10 days after she got COVID, her hands swole up and then her feet swole up. Her hands swole up to the point where she couldn't wrap her hands around the steering wheel to drive herself to the emergency department. I said, you got to go to the emergency room. If your hands swell up and your feet swell up, when your lower extremities swell, that's because something is wrong. Your heart is either not pumping well enough to circulate the fluids, your kidneys are not filtering well enough to like something is wrong. This is not normal. And my daughter sat at a local, and I'm not going to name the hospital because it's not about the specific hospital, but she sat at a local hospital for 7.5 hours. And the only interaction she had with a staff person was somebody took her basic vital signs. And those vitals weren't great. Her blood pressure was elevated and her heartbeat was abnormal. It wasn't severe enough for them to take her back or do anything. And she had to sit in the waiting room for 7.5 hours. The story she told me, she said there was a person in the room with her in severe pain, crying out the whole time. Because she had been a recent COVID case, even though she had cleared the virus and had a negative COVID test, they said, you've had COVID within the last 14 days. She was there with another man who she said he felt like he had an elephant on his chest. And she said, Mom, I was watching him. When he was breathing, his chest was barely moving. You know, when you breathe, you take air, and your chest puffs up and it goes down. She said, Mom, his chest was barely moving because he wasn't able to pull in enough air. The emergency department was bringing pillows and blankets to the people in the emergency room. People are coming in having had car crashes. You know, you have a car crash. Normally you come in by ambulance. They bring you in right to the back. Can you imagine coming into the emergency department by ambulance and being brought into the waiting room, being triaged in the back and then being brought out to the waiting room? I need people to understand. I want to really impress this on people. The emergency departments, I don't care if we're talking about Flint, Genesee County. I called a colleague in Ann Arbor at Michigan Medicine, a colleague at Beaumont. I called a colleague at Wayne State. All of the hospitals, all of the emergency departments are over full. We've got people having strokes, heart attacks, slicing their hand, breaking their leg. Every normal thing that was happening is still happening. Plus, we've got this flood of COVID patients who are having real problems with this virus. People are having real problems and they're coming into the emergency department and they're not being treated like an emergent case because the emergency departments are beyond capacity. People are complaining about the staff being nasty or being unhelpful, but these are people who've been forced to work 16-hour shifts, also to be away from their families. The hospitals cannot tolerate anything else. They are at or beyond capacity. So if your child breaks their arm or breaks their leg and you bring them to the emergency department right now, be prepared for a 16-hour wait minimum. Know that you will not be able to get pain medicine for your child because until a physician is managing the case, no medication can be administered. The hospitals are overwhelmed. We have got to do everything we can to prevent people that don't have to be in the emergency department, in the emergency room, from being there. And I know people might say, well, getting the vaccine, if it's not going to stop me from getting COVID, ain't enough. But if it stops you from going to the hospital, that's going to have to be enough. Because you will go to the hospital feeling like you have an elephant on your chest, not able to catch your breath, and you will be sitting in the waiting room suffering. While similarly, somebody's grandmother or uncle or auntie or mother or husband or sister or child is there with another illness that also can't go back because the hospitals are beyond capacity. We have literally stretched our already fractured healthcare system beyond the point of help. They can't do anything more. And the people that work there are people. They're not superheroes. They're real people just like me and you. They don't want to work 16, 24-hour shifts. And it's an unfair ask for them because guess what? They got families too. So people got to do their part. Because here's what I know, Art. Guess what? And you was one of them people. So now I'm going to pick on you a little bit because you can pick on me. Because I didn't want to get vaccinated. I didn't. And when I had the opportunity to get vaccinated, I had a lot of hesitancy and a lot of reluctance. But guess what I did? I took that hesitancy with me to my appointment when I got my vaccine. I wasn't like skipping in there like, oh, I'm so happy to be getting vaccinated. I said, man, I hope this better be what they said it was. The data I saw better be real. If not, I'm going to be as fierce in my trying to get retribution for those of us who did the air quote right thing, right? I had to take that with me when I went and got my vaccine. I took that hesitancy with me.
You know what I thought about when I went and took it? And this is no lie, right? I thought about being in the military. We have to take, I don't know how many shots when we first get in the military. And to this day, I don't know what shots I took. And they was vaccines, right? Vaccines and all kinds of shots. And then after I thought about that, I said, you know what? A lot of people see me on Facebook all the time. And I didn't want to say, hey, I took the shot, you go take the shot, right? I didn't want to say that. But I felt like, you know, my name was out there. My name was out there. And the thing was, if something happens, a reaction or whatever to this vaccine shot, people will know. And hey, you know what? I'll be that sacrificial lamb to show people that either it's not any good or it's good. But I wouldn't have to say it. All I have to do is just say I took the shot. Now I'm saying it because my heart hurts for the people who didn't take the shot or who has gotten infected with this virus and they are on ventilators. My heart hurts for the doctors and the nurses. I mean, think about it, y'all. People who's working at McDonald's or wherever, right? And you worked in all these hours, these shifts at truck and bus or whatever. You don't have to see death every single day. You don't have to put yourself in the shoes of these nurses and doctors who take this personal. They have to see death. They have to go home and think about the person that they couldn't save. Say, for instance, somebody died in that hallway. That sticks with them because they couldn't get to that individual quick enough. All right, that sticks with them, y'all. If we can do just, I mean, if wearing a mask saved 2 people out of 10, so be it. We save those 2 people from having to go to the emergency room. This is the thing here. This is the issue here. We have to make it, because it's like a chain reaction. By so many people being in the hospital for COVID, they can't get to the other illnesses. People who need surgery, outpatient surgery, they can't even get to them because it's so much COVID, so many COVID patients. I'm just saying, everybody, listen, this is a war against a pandemic, against a virus. And we all have to do our part in trying to save each other. That's all I'm saying, everybody. That's it. That's all I'm saying.
Can I add one more thing, Art?
Yes.
Since we fight, you being real respectful and nice right now. I really appreciate that because you be giving me the blues offline. Here's my thing. For the people who remain, and don't get me wrong, I will acknowledge, I do feel like there's an overemphasis on just the vaccine. And I will make no secret about it. I want people to get the vaccine. I want that. Get your vaccine, get your booster. Like, I want people to do that. Okay. And I want you to practice the other layers of protection. That's everything. That's if you can work from home, work from home. If you can't and you have to go into the office, okay, fine, or you have to go physically on site. But if you can work from home and that's manageable, work from home. If you can avoid the large crowds and the large gatherings, do that. Wear your mask. That mask is everything. And now we know for Omicron, you've got to wear a mask because it's so sticky. And a very little bit of it will get in your nose, in your throat, or your eyes. See, people don't realize your hands, this is the primary vector. This is how people are getting COVID. They're breathing it in or they're getting it in with their hands. Why? Because let's say I'm out at the market. I'm on the phone with my daughter. Okay, I'm at the store. What y'all need? Y'all want this, that, the third? Okay, great. Okay, let me see. I grab a product. I touch it. I say, oh, no, I don't want that one. I put it back. Grab my phone here. My phone is my third hand. Whatever was on that product that I just touched, that somebody before me touched, I touched it, touched my phone, touched my face. I just gave myself COVID. That's how this works. Like, people got to have their mask on. They got to be mindful. They just got to appreciate we are in the throes of a pandemic. You don't got to be fearful. You don't got to be living in, just can't be around anybody. You don't have to do that. But the basic things, hand hygiene, I always tell people, and I got this from my good colleague and friend now, Dr. Shanina Knighton. This is your third hand. This is probably the dirtiest, most problematic thing in your whole life because we can't function. We out in the world with this thing everywhere. This is your vector. You take this, you put this up against your ear, you touch it, and then you rub your eye. You touch it and you cover your mouth when you sneeze. Everything that's on this, you putting in your eyes, your nose, your mouth. This is your third hand. This is look at just the smudge prints on mine, just from my handprint. Just from being on this call, Arthur. Look at that. This your third hand right here. You know what I'm saying? So all the layers. The vaccine is the foundation. Vaccines are the foundation of prevention. We don't think about bubonic plague, measles, mumps, all this stuff that used to kill people and cause disability because we don't deal with that stuff because of vaccines. You know what I'm saying? So the vaccine, yes, get it. Get your booster, but also wear that mask. I don't care what the hell they say in Lansing. I don't care what state mandate is in place. You put your mask on for yourself and your family and your community. You put your mask on because it's the right thing to do because we are still in a pandemic. You go to other parts of the world. I got a good friend that came to visit me today. She spent a month and a half in Spain and Portugal. She said they're 90% vaccinated in Spain, 85% in Portugal. She said every time people go indoors, mind you, it's warmer there, so they're outdoors a lot. They're unmasked. She said as soon as people go inside, they pull a mask out and put a mask on. And it's like no big deal to them. They're just like, if this has to be our normal routine so we can live life, then we'll do it. But here, people act like wearing a mask is this monstrous inconvenience. So I ask people to think of it like this. You don't want to wear your mask. Ask yourself, when you walk into the store unmasked, how many of the 100 people in here am I willing to be the person that brings them something that might kill them? One. Because mind you, if it's only a 1% death rate, you walk in a place that's got 100 people, you could have been like me. COVID positive, didn't know it. But I kept my mask on so I didn't infect anybody else. But if I didn't have my mask on, if it's a 1% death rate and I exposed 100 people, one of those 100 people, I was going to kill them. I would have been the person that brought them the virus that killed them. So the real question is, how many people in this room are you willing to kill? If the answer is 0, wear your mask. Wear your mask. Get your vaccine. Have those conversations with your other friends and family and be mindful when you're out. Like, this stuff we got to do is basic. What people don't realize is COVID is going nowhere. It is now with us. It's what we call endemic. It's with us. The game now is to figure out how to live with it. We're not going to be able to get rid of this. We're figuring out now how to live with it. And I just personally, the thought that I would walk into a building and somebody gave me a gun and said, you got to kill one person in this room, pick, I would say, I'm not going in the room then. But if you walk in a room with 100 people unmasked, that's basically what you're saying. I'm willing to potentially be the assassin for one of these people. And I just don't think it's worth it.
And Dr. Verhoeven, I just want the people to know also, we're not trying to fearmonger. We're not trying to fearmonger. We're not trying to scare you. The virus doing that anyway. I mean, I'm looking at the numbers this morning with New York. I think they said 55,000 people got it in New York. This to me, even though they saying that Omicron isn't that bad, one, I think they just saying that so that they can save the economy. Two, I think they saying it because 61% of the people population has gotten the vaccination shots. Myself, personally, I think this variant is worse than all the rest of them. Because I'm hearing people left and right saying that they have it, that takes precaution. They really go out. But like one person I know for sure got it from being at work. Two people, matter of fact, got it from being at work. What's the thing that you say all the time? Wash your hands. And what was the first things that was said when it first came out that we can do to prevent getting COVID? Name those things.
Came up with my own. I love like something quick and easy to get people to remember. From day one, March, before the president declared a pandemic, I came up with my 3 W's. And it was wear your mask, watch your distance, and wash your hands. Those were my 3 W's. Wear your mask, watch your distance. That idea of social distancing, I don't like that. Human beings are not meant to operate in social isolation. So when I say watch your distance, I mean, watch how close you are to strangers, people you don't know, people who are unmasked, or people who are coughing and sneezing and all of that. You can be around people, but you got to know there's a risk in being around people, and you got to watch that. You got to watch who you around. Remember the HIV days? What they say back then, know your status. See, we have made the status, right? Know your status. So remember in them late 80s, early mid 90s, when the music was on and you was feeling good and you was getting romantic. Like, baby, did you have your HIV test? When the last time you got tested? And we had real conversations.
Right.
But people don't talk about the thing that people are talking about now is your vaccination status. And yeah, your vaccination status is important. That's important for you. The vaccine is for you. At this point, that whole taking one for the team, for the greater good, we have passed the point where that is the case. You are getting the vaccine now for yourself.
Right.
I want to be real clear. Herd immunity has left the station. We are never going to get that now. That is not going to happen now. The vaccine is for you. The status that I need to know is, what is your COVID status? Are you COVID negative or COVID positive? Real talk. Let's say you had to take a flight and you say you can only know one piece of information about the person, the stranger sitting next to you on that flight. What would you rather know? Whether or not they've had the vaccine or whether or not they've had a negative COVID test within the last 24 hours?
I want to know if they has the vaccine.
I want to know if they had a negative COVID test.
Hey,
Because
I'm
you might
scared
have
of the
the
test,
vaccine, but
but
you might have COVID.
see, one thing about it, I've been seeing a lot of false positives and false negatives with the same day results instead of a PCR. But with the vaccine shot, hey, you know what? My possibility is more greater with that than it is.
So that's a good point. Let's talk about that. That's a good point. It's a good point. It's a good point. I want to know their test result. I want to know that they have a negative test. But the point that you make is still a good one. And the good point that you're making is if somebody is vaccinated, and you heard the early reports about, vaccinated people can get just as high of viral loads, and that wasn't entirely the case. The problem with the vaccine is the vaccine doesn't sanitize the airway. It doesn't sanitize your nose. It doesn't sanitize your throat. So you can get virus that will proliferate in your nose or in your throat. And if you're taking a swab in the nose or in the throat of somebody early in their exposure, it might look very much the same for somebody who's vaccinated versus unvaccinated. But typically, the reason that people who are unvaccinated have less severe COVID is because when it gets to the cellular level, you've got all of that immune response ready in your body to fight. And so you don't get as much viral replication. And when it gets to that level, your body was like, oh, we recognize this, and it fights it off. So the vaccine status is a good thing, right?
Right.
But we also need to make sure that people, even if you're vaccinated, because we know that you can still become infected, you will likely not get as sick as if you were unvaccinated, but you can still potentially spread it to others. That's why we all just have to keep our guards up and do those basic things: washing our hands, watching our distance, wearing our mask. And if more people were vaccinated, we would see less spread. Remember, mutations occur when the virus replicates.
Right.
You get less replication of the virus in people who are vaccinated. So when you have people who are unvaccinated and immunocompromised or already sick, you get a lot of viral replication. It's like making a copy. Every time the virus copies itself, remember, our cells are turning over every day. Every day they're turning over and making copies of themselves. And when those copies are made, mistakes happen. For a virus, those mistakes make the virus stronger, more ferocious. I call Omicron the wildfire variant. It spreads like wildfire.
Right.
And the Delta variant was the destroyer. Delta liked to destroy people. Omicron likes to spread like wildfire.
And being, like I said, I was an NBC specialist in the military. I want to know, and I know we're not going to be on here but another 2-3 minutes.
Yeah.
But we really have to, find somebody that we can get in depth with. Where I want to know, because I keep saying that this variant or this virus has a brain of its own. Because where I was reading, where this one, Omicron, they say it normally doesn't go all the way back to the beginning and pick up characteristics from the other variants. But this one, they said it seemed like it went back and picked up some of the characteristics from the other ones. That's why I'm asking people to wear a mask and get the vaccine, wash your hands, watch your distancing, just do everything that you can to assist in this war. Even President Trump, the people that he that follows him is against him now, because he's even advocating and saying, take the booster shot, take the vaccine shot. Hey, this is serious and the vaccine works. They are against him and they booed him on the stage. And Candace Owens and Alex Jones called him ignorant yesterday. So if President Trump is saying this, You should be saying the same thing, everybody. You should be you should be out here. I can't speak for you. I can't speak for you, Facebook fam. All I can do is ask you to wear your mask if you can, get the vaccine, and tell your family and your friends to do the same so that we can lessen this blow. We can't, I'm not saying that it's going to help everybody or it's the cure. But what I am saying is it'll help those doctors, it'll help the people who have to go in the emergency for something other than COVID. We all have to play our role and our part in saving each other. So that's all I have to say. And I know Dr. Verhoeven, you take us, you take it out because hey, this is your lane.
All right. Well, I want to make sure I just answer a couple quick questions.
Okay.
So Becky said, give us a 411 about sending students back to school. Kids are already little germ mongers. I'm just saying that they are. Y'all know. They just, you can send your kid to school, send them with a Superman mask, and watch don't he come home with a Batman mask. I'm just saying, we already know how kids are. So if we're going to send our kids back to school, then we need those precautions in place for kids. And unfortunately, not all kids have the same resources. We got a lot of kids. I've seen kids literally, we all know, you've seen a kid come in with the same pair of pants on with a stain in the same spot on his knee 4 or 5 days on end. You know what that means. That kid got them same pair of pants on. They're not getting washed. They're not getting taken care of, and all of that. So not all of our kids have the same resources, number one. Number two, the schools many of them have missed the opportunity because they weren't properly resourced to put some basic things in place. Y'all notice I got my Cool Mist humidifier. That humidifier makes the air moist. I keep my the ceiling fans are debatable, but I have my fan pointing up, blowing the air out. When I have people over, I crack the top of my windows because I have the windows where the top will go down. So air is going up, spray goes up, goes out the top of my windows, and then I have a little crack at the bottom and fresh air comes in, and I constantly have the air handler on in my house. So I'm getting air exchange. I'm getting stale air out of my house and fresh air in my house. Why? Because I've had COVID positive people in my house. I want to make sure we got fresh air exchange. These are some of those very basic things. And we don't talk enough about that. We haven't talked a lot about what people can do to boost up their immune systems. The fact that many of us, I have not shared this with many people. I'm only going to share it because it's Arthur Woodson's live stream.
I feel privileged.
But I started COVID a smoker. I ain't even going to lie. I was like a little closet smoker. And I quit smoking during COVID because I couldn't make that recommendation for others to reduce your drinking, to cut back your smoking and all that if I myself wasn't willing to take that on.
Right.
And I'll spare you, but for all my current or former smokers, I really, it was like smoking was like my buddy. But I realized I'm like, when we dealing with a virus that attacks your lungs and causes all these respiratory problems, I was like, I can't put myself in excess, harm's way that way. So there's a lot that we can do. But the vaccine really is the foundation of the prevention strategy. It is. The vaccine, the masking, and the watching your distance and washing your hands. Those are the foundations. If we can just reliably and consistently do those 4 things, Art, I'll come back anytime you want and talk about some of the other things, because I have a whole lot of things that I do in my life that I know have kept me and my family safe and well. Everything from the humidifier, the routine that we use to sanitize our nose and our throats, what we have when you enter into my house around, people cleansing their hands and gargling and rinse, washing out their noses and sanitizing their noses. There's a lot that people can be doing, the things that I've been doing to boost my immune system, the vitamin regimen that I'm on. Like, truly, I was really happy when I contracted COVID that I had the experience that I had. I can't say that the things that I've done caused that experience. I could have just been one of the lucky ones, but I will say I did everything I could in my power to give myself the best opportunity and my healthiest opportunity. I've lost 10, 12 pounds during COVID. There's a lot that we could be doing. I think we want to talk about that too. But
Yeah.
make no mistake about it. Getting vaccinated, practicing that good hand hygiene, watching your distance and washing your hands. Those things you just have to do. If we're going to send the babies back to school, we need good provisions in place in those schools, good air exchange systems, guaranteed PPE for staff and for all students, and good monitoring such that if there are any outbreaks in schools, parents and students get alerted and we can adjust and correct as needed. We all know and appreciate, I think, that having our students in school is what's best for them, because kids get more than just their education in school. They get more than that. They get attention. A lot of kids get nurtured and loved up on. They eat. You know how many kids are getting 2 to 3 meals a day at school? So all these things are important.
Right.
And it can be done, and it can be done well. And I do agree the goal is to get our kids back in school, but we want to do that in ways that are safe and equitable, because it shouldn't matter how rich your school district is or if you public or private. Every child deserves a safe and supporting learning environment, period.
Correct.
Yeah.
Well, I know you said hey, we just did this off the cuff, so we gotta definitely come back on, and we definitely have to be ready to really go in depth. This was something that you and I just discussed off the hip. But if
I
there's some more
know. And
questions,
here you got me here. You got Arthur Woodson called, you got to answer.
if there's some more questions you want to answer, hey, I'm here with you. What happened now?
I'm looking at some of it. I want to make sure we got people's questions done. This is a goodie. When the virus mutates, does it get stronger? I will say this: the World Health Organization (WHO) has 2 categories of viruses that get a name and become viruses of concern. Those are mutations that either cause more illness or that spread more easily. The Omicron variant is not exactly a variation or mutations on Delta, right? The big variations that we have seen with Omicron are on what's called the spike protein. And depending on what scientist you ask, there's somewhere on the order of 30 to 40 plus mutations on that spike protein that, I will just say in layman's terms, make it stickier, make it more easily to bind to those ACE2 receptors in your nose and your throat and your body and all of that, and more easily replicating and reproducing itself quicker and more efficiently. So, this notion that Omicron is somehow better because it'll just be like a mild cold and you don't have to worry about it. Literally, all we'd have to have happen is some additional mutations in that replication copy process where it causes more illness, and then we would be in a world of trouble.
But
So,
Dr. Verhoeven, can we honestly say that Omicron isn't that severe when it's only been out for a month? We really don't have too much data on Omicron to really necessarily say that it's not that severe, because right now what I'm seeing is some severe stuff, man. Even with vaccinated people with a booster. So, and that's what really made me want to come out and say something, because I'm hearing one thing, but I'm seeing something totally different. And, that's what scares me, is that they say it's not that severe, but I'm seeing severe.
Yeah, I would tell people take all that you're hearing with a grain of salt. Unfortunately, our politicians are saying lead with the science, but they're not leading with the science. They're trying to give people a message of hope. And I personally, and a lot of people might disagree with me on this, I don't want to give you hope. I want to give you the information and you can create your own hope from that. I like to give people what I call the weather report. I don't want to give you doom and gloom. I don't want to give you lies or make it sound better than it is. And I don't want to make it sound worse than it is. I just want to give you the facts as I know them and I understand them. And you can create from that and do with that what you will. You know what I'm saying? So I
Right.
feel like they're trying to sell people this hope that this version of the virus will just be like a cold, so you don't have to worry. And I just think that's dangerous.
Yeah, I do too. I mean,
And I don't like it because it doesn't jive with it doesn't jive with my own lived experience. Again, I can't say that what my daughter experienced was caused by COVID. There's causal and coincident. It could have just been coincidence. They just happened at the same time. If I was to eat pancakes for breakfast and then later fall down the steps, I wouldn't say the pancakes caused me to fall down the steps, right?
right.
It happened on the same day. So I can't say that her COVID caused the flare up of her heart arrhythmia, which signaled some other problems that caused her to have, some poor circulation. And I don't know, but it ain't worth the risk because it's preventable.
Well, what I know is that one friend, sister is on a ventilator. My fellow activist, Tony Palladino, and I need everybody to pray for him. He's still the same right now. And my cousin, I talked to my cousin, his mom today, and he said, at night, during the day he's all right, but at night is when it hits him. And he said that, he wanted to go to the bathroom and couldn't even make it to the bathroom. And next thing he knew, he woke up in a chair. He said it feels like somebody's sitting on his chest. He can barely breathe. This right here, y'all, is no joke. And I'm just asking everybody, let's be aware of our surroundings. Let's help each other out. If we can stop it, I mean not stop it, but protect each other by wearing a mask, getting vaccinated. Let's do it, y'all. For real. Let's do it, and let's make things better for all of us, not just some of us. I understand you being cautious. I understand that, man. I truly do. But right now, we are at the brink right now, everybody. We are at the brink of a meltdown, economically, medically. I mean, you name it, we are there. We gotta put a stop to it. So that's my ask to you. Let's wear a mask. If you can build up the courage, hey, let's get vaccinated. Let's do our part in helping one another.
Yes, I like that message, and we'll come back. And Art, I will invite one of my good colleagues who's an infection preventionist to talk to folks about what they can do in their lives without being fearful, without doing the most, but how to engage with people safely and also prevent the spread of infection. She's a infection preventionist at Case Western, real sister. Her name's Shanina Knight, and I love her to pieces. She just provides so much real and practical advice and information for people that is built on her 15 plus years of doing work in hospitals and community care settings to prevent the spread of infection from person to person. My uncle is in the hospital right now. He has COPD. He went in for one thing and contracted MRSA in the hospital, and now he's battling MRSA.
Wow.
this hospital-borne infection. And I'm praying he don't get doesn't get COVID. He gets COVID, it'll kill him.
Wow.
So I want to give people all those tools and skills. So next time, maybe we take it up that next level, because we've hit our hour mark.
Yeah. So let me say this real quick to all the people that know me. I got to say this to some of the people who don't know me. I will never sell my soul. I will never sell out. So all the people who think, because I know I got some people out there that's going to say this, I have not taken a dime for doing this.
Oh, yeah.
I have a heart. I see my cousin. I see my friends. I have a heart. And I just wanted to get the message out there. Like I said, me and Dr. Verholden, I called her, asking her some questions about, how can I help my cousin? And we got to talking, and I told Dr. Verholden, I said, you know what, Dr. Verholden, I'm getting ready to do a Facebook Live. And this was like 6 o'clock. And we got to going. Now, Dr. Verholden, I said, Dr. Verholden, would you come on and so that you can speak to the people? Because I can talk one way and you can talk another. And that's how we came up with this. And it was just off the cuff. So don't think anybody is getting paid for this to do advertisement or do anything else, because I just had to say this because we have people who think this way. And I like for people to understand that I don't take money from organizations or foundations or anything else. I do this because I love my city and I love my country and I love my friends, family, and people who I do not know. I love them also. So I'm just getting out here just trying to help fight this war, because that's what it is. It's a war against a pandemic, a virus, and all of us need to do what we can to fight this war. So I'm done.
All right. And I want to acknowledge people. We ain't here to agree. I don't mind disagreement. And I appreciate that people understand we just giving of ourselves and our time and talent and treasure because we care about this community. So thank y'all, because we here for y'all.
All right. Thank you, Dr.
Art. Be easy and Happy New Year to everybody.
Happy New Year, everybody. Thank you.